I'm really happy to be here today. I am a patient, a doctor, a mother of 4 daughters, a wife. 2 of my daughters are here. Thanks for coming. Thank you, God, for a voice and the privilege of standing before you amazing, concerned individuals to speak the truth about Obamacare. The manifesto for the promised fundamental transformation of the United States of America, also known as tyranny through medicine. How fitting that we convene here at the Patriots rally. Texas, home of the Alamo and the Come and Take It flag. Texas, no stranger to sacrifice because of the ability to individually achieve a result. Texas, my home, our home. My father's home. My father was born just a few hours south of here in Alice, Texas, in a house that had no electricity, no plumbing, but a home that cultivated a work ethic that enabled a little boy to achieve the American dream. He worked hard. His first paying job was at the Sinclair service station and then across the street at the Gulf. And when he was about 13, driving the company truck, the jack fell out of the back, and he spent the entire summer wages paying for the jack. He studied hard by a kerosene lantern. And through hard work and education, escaped poverty to achieve the American dream. He went on to graduate from Vanderbilt Medical School and ultimately became an innovative, pioneering chairman of neurosurgery, the first chairman of neurosurgery in San Antonio. Just like another exceptional man who overcame poverty by hard work and education, we've talked about him, neurosurgeon Dr. Ben Carson. These are men of truth, livers of the dream. You can do whatever you want to do and be whatever you want to be, according to these men. Sacrifice, individual importance, a work ethic, responsibility, accountability, innovation, pioneering, unlimited potential, the American dream. Truth, this is where we came from, this is who we are, and this is why we're here today. My father and Dr. Ben Carson epitomize the American physician who lives by the Hippocratic Oath, honors the tradition, serves the sick with dignity and compassion, and advances the field of medicine so that we leave it better than we found it. This is their role, this is their calling. Throughout history, there have been 2 competing roles for the physicians in society. American physicians take the Hippocratic Oath and follow Hippocrates, where we are free to serve the best interest of the individual patient. Conversely, physicians follow Plato and become servants of the state, compelled to serve the greater good of society. At some point, it becomes the patient's duty to stop consuming what belongs to the state, and the physician's duty to help them serve society, the duty to help them go without care. Government's promise of affordable, quality health care for all sounds so noble, but the fact is, whoever pays holds the power to choose. So when DC gains control over the healthcare money and power, physicians become employees of the state. We become Plato's physicians, for whom collective good trumps the individual well-being of the patient. What Americans must know is that the architects of Obamacare are Plato's physicians. They and their law serve the state. They and their law regard the American patient and physician with disdain and detachment in the place of dignity and compassion. With federal money comes increased regulatory oversight and control of behavior. With control of behavior comes increased control over medical decision-making. Obamacare architects call this comparative effectiveness research, paper performance, and meaningful use, and grant the Secretary of Health and Human Services, a non-doctor presidential appointee, limitless power to enforce this. A most alarming part of Obamacare is Section 1311 H1B, which gives the Secretary blanket authority to dictate how doctors treat patients, not just patients in government plans like Medicare and Medicaid, but also those with private plans that they pay for themselves. Quote, the powers given to the Secretary are so broad that he or she could literally dictate how all physicians nationwide practice medicine, warns physician Congressman Phil Gingrey, who is sponsoring a bill to repeal this. The Federal Register revealed these rules are being written, and when they are in place, insurance companies will only be able to contract with doctors who comply with the Secretary's rules. The Secretary, a Washington bureaucrat with no medical training, could prohibit doctors from doing what they believe is best for the patient. Instead, government will be calling the shots on what the patient gets, and the government will punish doctors who do not obey their rules. Dr. Ezekiel Emanuel was the president's key health care advisor when the Affordable Care Act was written. He's the brother of Rahm Emanuel, former White House chief of staff and Obama's Chicago crony. Zeke Emanuel is a Harvard bioethicist who prefers Plato to Hippocrates. Emanuel says, doctors take the Hippocratic oath too seriously as an imperative to do everything for the patient, regardless of the cost or effect on others. As long as doctors are in charge, cost control would not be possible. In his classic article on rationing, published in Lancet in 2009, Emanuel advocates for federal rules to allocate resources to patients based on what he calls social justice. The article introduced Emanuel's new rationing system, the complete life system, and the Grim Reaper curve, where care is preferentially given to patients between the ages of 15 and 45. In certain empires in history, like Plato's Republic, the state's interests were primary. So physicians responded to the needs of the state by devoting resources to the workers and ignoring the elderly, the very young, the critically ill, and those who were considered genetically inferior. Vile immorality and atrocities resulted. In his article, Principles for Allocation of Scarce Medical Intervention, Obama architect Ezekiel Emanuel espouses the principles of Plato to a T. The Obamacare operatives are a new breed for America. Like Emanuel, they believe the Hippocratic Oath is obsolete and follow the statist ideals of Plato's physicians. Knowing his nominee to run the Centers for Medicare and Medicaid Services, CMS, would not be approved, Obama used a Senate recess appointment to make Donald Berwick the first head of the CMS. Like Emanuel, Berwick, who loves the British system of socialized medicine, contends that the federal government must step in between doctors and their patients to curb and redistribute the use of medical resource. Berwick believes resources should be allocated based on important subgroups rather than individual patients. So now groups, instead of individual patients in the doctor's office, should be the unit of concern. Obamacare puts the federal government between you and your doctor and works towards limiting your care. Obamacare grants the secretary the power to decide what physicians should spend on each patient. Doctors who spend more will be punished financially. Many physicians are leaving the field, unwilling to comply with such oppressive terms. According to Section 3007, though, punishment cannot be challenged in court. Quote, there shall be no judicial review. Government is seeking and training providers willing to practice under their abusive control, even if it means worse quality care. How did we get from the American dream to the Obamacare nightmare? From the patient-doctor relationship to the government insurance company relationship? We were deceived. The American people are compassionate, generous, and trusting. We were manipulated and duped by a group of political elites preying on our virtues to fundamentally transform the United States of America. Who can argue against affordable quality health care for all, even if it's a false promise? If you like your health plan, you can keep your health plan. If you like your doctor, you can keep your doctor. This was all a lie, period. They knew it, and they chose to do it, to lie anyway. This is the greatest hoax ever perpetrated on a free people in world history. Why do they want Obamacare so badly at any cost? Because, in the words of Joseph Stalin, socialized medicine is the keystone in the arch of socialism. Our federal government has been commandeered by statists whose goal is to change us. The key to this transformation lies in the co-opting and controlling of our lives. We the people did not want this then, and we the people do not want this now, but the collectivists do. It's been in the making for years and finally passed amidst the perfect storm that began with the election of President Obama and a Democratic House and a Democratic Senate on his coattails. Then came the unprecedented expansion of the executive power, appointing czars whose only credentials were that they were loyal cronies or donors due payback. For the government takeover of medicine, they also called up single-payer advocates of Plato's persuasion like Emanuel, Berwick, Sibelius, and his newest payback nominee for Surgeon General, Dr. Vivek Murthy. Obama and his inner circle of Obamacare enforcers are disciples of Saul Alinsky, the author of their playbook, Rules for Radicals. They are the original community organizers who do whatever it takes, including lying, creating issues, division, polarization, fabricating crisis, fanning the flames of class warfare, and exploiting racism to take power to achieve their goals. This is antithetical to the patient-doctor relationship. Understand that the crisis of the uninsured was trumped up and magnified in the first place. Healthcare economist Sally Pipes showed in 2008 that in reality, the 30 million uninsured were really 10 million uninsured, who in actuality would not be denied care. The real problem is the existing dysfunctional system. But to get control, Obamacare has made things worse for all 315 million of us Americans in the name of helping 10 million who still can't get insured because they still can't afford the premiums, which are now higher, 3 times higher. Only 500,000 uninsured have gotten insured. While Obamacare has led to higher premiums, 4 out of 5 companies will raise them, and more restrictions for all. Obamacare came to us in 2 parts. Part 1 was in the stimulus. Billions of dollars were taken from Medicare and used to set up the comparative effectiveness research, which is led by a 15-member federal coordinating council to which Emanuel and his buddies were appointed. Then health information technology, government's portal into patients' medical records and IRS returns, and doctors' offices, operating rooms, and bank accounts. Billions have been spent coercing physicians to participate in this. This marked the beginning of the end of the sacred patient-doctor relationship, Hippocratic medicine, and the U.S. economy. Then Part 2 of Obamacare came in the paradoxically named Patient Protection and Affordable Care Act, known as the ACA. This law was passed against the will of the people in the eye of the perfect progressive storm under single-party control of the House, Senate, and White House using procedural trickery, reconciliation, House Speaker Pelosi arm-twisting and infamously passing it without reading it, bribing a la Mary Landrieu's Louisiana Purchase, lying a la Obama's promise of executive ordering away public-funded abortion, thus getting 8 needed Democrat votes, extorting a la the AMA so that the AMA would not lose its $100 million per year in government payouts for CPT codes. The AMA defrauded the American people, a lot like AARP. Americans look to the AMA as representative of physicians. We trust our medical care. In reality, the AMA is a quasi-government agency led by the CEO, Dr. James Madera. The AMA CEO is a Michelle Obama Chicago crony. They have worked together. He resigned from the medical school deanship in Chicago over a problem with something they were working on together. That's our CEO of the AMA. Less than 15% of physicians are even members. Like the AMA, the American Board of Internal Medicine, and other specialty boards make hundreds and hundreds of millions of dollars from deals with the government related to billing, coding, and certification scams called MOC and MOL, not from membership dues and not from representing the vast majority of physicians. The AMA has lobbyists. Individual physicians and patients do not. Then, when the illegitimate passage was challenged in the Supreme Court, Chief Justice John Roberts strangely legislated from the bench, literally reinterpreting and rewriting the law to let it stand. This is how they forced it on us against our will. They now call it the law of the land, and they tell us to get over it and accept it. They say, yes, we can, and yes, you will. We say, no, we won't. Obamacare is a train wreck of epic proportion. I've read it. The first time I read the thousands pages, I was shocked at the flagrant power and money grab. Hundreds of times the phrases "the secretary shall" and allocation of money in such sums as may be necessary are written into the law, giving the president and his secretary carte blanche with our money and our lives. I live it as a doctor in the trenches with my patients and as a patient in the trenches with my doctors. This is becoming glaringly obvious for all to see. But the Obamacare operatives continue spending millions and billions to propagandize their false medical utopia with falsehoods, talking points, bad ads, and Alinskyite organizations cloaked as 501c3s like Organizing for Action on one hand, and blatant attacks on actual patients and demonization of doctors on the other. Remember when Obama said surgeons will take out tonsils for money, and that surgeons are immediately paid $30,000, $40,000, $50,000 to cut off a diabetic's foot? In reality, he lied again. We agonize over what we operate on with our patients. A popular insurance allowable for tonsillectomy and adenoidectomy is $250. And a surgeon gets paid more like $500, not $500, but $50,000 to do a below-knee amputation. And remember when he said, you know what? We'll let doctors know, and your mom know, whether it's better to have surgery or take the painkiller. He meant it. There are sections in Obamacare devoted to all aspects of doling out pain management. Of most recent concern, President Obama is unilaterally changing his law of the land, now somewhere around 30 times, at his whim for political expediency. Whether to appease lobbyists, his progressive base, or members of his party up for re-election, he changes the law with zero regard for the individual patient. If he truly cared about the individual patient, why did he delay Obamacare for those with employer-sponsored plans and not for those with individual plans? And if he truly cared about individuals, why did he delay the cap on their out-of-pocket expenses? He responds to lobbyists and politics, money, and power. Individuals do not have lobbyists' money or power to influence Obama to use his mighty phone or pen on his behalf, on their behalf. Obamacare supporters say opponents just want to go back to the status quo. This is not true. Physicians and patients have seen the consequences of government-run medicine and its trillions of dollars in unfunded liabilities barreling down the tracks, and we're clamoring for reform. We were ignored, stonewalled, and suppressed by government in collusion with insurance, hospitals, and big pharma via lobbyists spending billions yearly. We needed good reform. We got bad reform. Medicaid, created 50 years ago as the government's safety net for the poor, has bloated into unfunded liability of epic proportion. It will soon bankrupt the United States of America. It is exorbitantly expensive and has the worst outcomes of any health plan in the developed world. The uninsured have better outcomes than those insured by Medicaid. Most doctors won't participate in Medicaid. Medicaid needs to be fixed. So what does Obamacare do? It quadruples down on Medicaid, effectively seeking Medicaid for all as a single-payer government-run system. It started by expanding the definition of poverty so that more people qualify to be on Medicaid. It calls for the states to expand Medicaid. Instead of fixing it, it puts everybody on it, and the Alinskyite organizers rally for Medicaid and hire people to protest and demand it. Poverty and Medicaid for all. And I am attacked for saying do not expand Medicaid. But I want people to have good health care. Medicaid is the problem, not the solution. We must fix Medicaid, not expand it. We can and must do better. Obamacare is built on a series of perverse incentives. It is creating joblessness, inefficiency, poor access to care, and poor quality care. It has also created a whole new group of uninsured. Instead of achieving coverage for the uninsured, 6 million who had insurance lost their individual plans that they liked because they didn't meet the Secretary's mandates. Now these millions of patients who had affordable plans they liked got cancellation notices and have to buy new plans at much higher premiums with huge deductibles, with fewer doctors, hospitals, and meds, and on a dysfunctional, insecure website that risks their privacy and dignity. Only a small number, as we said, maybe 500,000, who have signed up on the exchanges were previously uninsured. Not surprisingly, the government forgot to or intentionally did not track How many newly covered were actually previously uninsured? We all witnessed the inept rollout of Obamacare exchanges on October 1st. While they called it a glitch, it was a massive failure. Billions of our dollars were and continue to be wasted on this proven failure. Again, cronies were chosen for the job, and they failed, squandering our money with no recourse. We know now that the uninsured are not signing up, and if they do, many are not paying the first month's premium, so they're not covered. And that's because the premiums and the deductibles are too high. The process is dysfunctional, insecure. The benefits are not individualized but government mandated and highly regulated. Effectively, we are all paying for rationed care. The typical individual plan for an average-aged individual now costs $9,000 to $10,000 a year in premiums and deductibles before it covers anything, and $20,000 for a family of 4 before it covers anything. And these dollars are taxed for the individual, whereas they are not for the employer-sponsored plans. Rather than fixing all the dysfunction, a dysfunctional law was woven upon it. Ezekiel Emanuel admitted this in a recent Wall Street Journal piece, and he writes about it in his book, Remaking American Healthcare. Americans must understand this scam so we can stop it and replace it with real patient-centered reform. Remember it by calling it the glitch, G-L-I-C-H. I know it's spelled wrong, but we're in Texas. Government, lobbyist, insurance company, hospital, collusion. Americans must understand that our federal government has chosen to collude with insurance companies, hospitals, drug companies to take total control of our healthcare system, and 1/6, if not 1/5 now, of the U.S. economy, rather than collaborate with patients and physicians to achieve good healthcare reform that benefits each individual patient. This unholy alliance is facilitated by lobbyists bearing gifts of money and power. Individual patients and physicians, by comparison, are penniless and powerless. We're nothing more than pawns in a game which we can play no more. This is the ultimate game of life, and the only way not to lose is not to play. We must understand this disease so we can fight it. There are 2 components to a medical bill. One component is the bill for the hospital or outpatient facility. Let's call this the hospital bill. The second component is the bill for the physician or surgeon services. Let's call this the doctor bill. We must make a very clear distinction between the bill and what is actually paid and by whom. When Americans talk about our staggering medical bills, we are predominantly referring to the hospital bill, which is nothing more than a usurious, manipulative tool. The hospital bill is staggering. It's enormously, artificially, and intentionally inflated to produce phantom losses, resulting in special tax treatment and subsidies for the hospitals, and scaring patients to death into believing that we cannot survive without expensive, comprehensive health insurance. Here is my real-life example. The hospital bills $12,000 for a very minor procedure on a woman with a gynecologic condition. The woman gasps at the bill when she opens the envelope and concludes, "Thank goodness I have health insurance. Everyone needs health insurance." In reality, the intentionally hard to decipher bill cloaks the billing game, the tax scam. While the hospital shows the patient the $12,000 bill, the hospital has actually agreed to accept far less from the insurance company. This is called an allowable, which in this case was $5,000. By billing $12,000 but accepting $5,000 from the insurance company, the hospital recognizes a $7,000 phantom loss, which it then reports on its tax return, thus remaining its nonprofit tax-favored status and getting government subsidies to boot. The individual patient, now with a huge $5,000 deductible because of Obamacare, writes the entire check to the hospital for $5,000 on top of her monthly $250 premiums, which total $3,000. If the patient was uninsured, she could have negotiated a direct fee for $1,200. So the hospital got $5,000 from the patient, plus $7,000 in tax write-offs and subsidies for less than $1,200 of services and supplies. The insurance company got $3,000 in premiums from the patient, who paid $0 to the hospital, while the patient paid all the $5,000 allowable because of the high Obamacare-induced deductible. The patient ended up paying $8,000, $5,000 in deductibles plus their $3,000 in premiums for the privilege of paying more than if she had no insurance. And the patient, the individual, gets no tax benefit for the health care expenses. Understand this. It's dysfunctional. She paid $8,000 instead of $1,200. $6,800 of her livelihood was essentially laundered to sustain a government lobbyist insurance company hospital collusion scam. The government, insurance company, and hospitals profit and get the tax breaks from our health, our bodies, and our lives by manipulating us and scaring us, and this is wrong. The surgeon's insurance company allowable was $500. For a relative pittance, the doctor assumes all the risk and must practice under oppressive, punitive, coercive, innovation, stifling, mind-numbing, ever-changing at the whim of a politician government control. The $500 must then be spent towards overhead, taxes, employees, rent, supplies, malpractice, continuing education, computers, and it doesn't make a dent in it. Doctors don't get tax breaks either. Doctors, we love our patients. We are all patients. Americans are generous and compassionate and self-sacrificing. Physicians and surgeons are willing to accept ridiculous agreements to retain our patients, who in reality have now been bought by government from insurance companies in collusion with hospitals. Doctors and patients must refuse to play this deadly game anymore. Stop and look who actually paid what to whom, not just what the hospital bills. Expose the truth. Americans are smart. When everyone understands what's going on, we can call out these gamers, get rid of their fixed game, and implement patient-centered healthcare reform at lower cost with increased choice, access to good doctors, and state-of-the-art care for all. In the meantime, we are complicit enablers. They cannot do this without us. You cannot get your appendix out or your broken hip fixed without a surgeon. Doctors and patients together, we must acknowledge the problem and stop enabling it. Only tough love can stop this cycle of addiction of these colluders to the power and money sucked from the lifeblood of the generous, compassionate, self-sacrificing, scammed and scared, but very smart American patient. The selective enforcement, exemption, and delays Obamacare has penned into the law have resulted in dictatorial behavior, which results in flagrant discrimination against certain groups of and individual Americans. For this reason, with great sadness, I submitted a letter of resignation and termination to Aetna after discovering that they had listed me on the Obamacare exchange. I will not comply with this law. I will not be an enabler to the dysfunction and discrimination against my fellow patients. I will not allow my services to be sold without my consent against my will on a federal marketplace through collusion. Aetna has, in classic Obama and Attorney General Holder fashion, stonewalled and ignored me down to the last hour in responding on this. 61% of doctors say their already bad opinion of the law has changed from bad to worse, and 44% of doctors surveyed say they will not participate in the exchange. When asked about this by Bill O'Reilly, Obamacare architect Zeke Emanuel arrogantly and contemptuously replied, quote, "Doctors will not opt out, not half of them. It's not doctors who participate with the exchanges, it's insurance companies that participate with the exchanges. The doctors will take who's in the exchange because they have to. There's a large number of people who will be there." Emanuel's disdain and contempt for doctors and patients is palpable. He states, "You don't need a doctor for every part of your health care." Obama advocates prefer to replace actual doctors with what they call physician extenders. They're willing to sacrifice lives for money and power and then dare to call this quality care. They deny that there's rationing and say there will be no rationing. But in true Alinsky fashion, there is massive top-down rationing. It's just called by other names and achieved in covert fashion. Obama's policy is secret and deceptive in practice. It's not open and transparent as promised. There are so many agencies, boards, and task forces in Obamacare that ration care that it would take me a semester graduate level course to cover them all. Rationing is achieved by restricted networks, restricted reimbursement, and risky regulation. If there are millions of patients mandated to buy Obamacare, but only hundreds of doctors and hospitals deemed qualified, by sheer numbers, you will wait in long lines to get care. Lives will be lost waiting for diagnosis and treatment. ERs, where care is more expensive, will explode, and late diagnosis, when treatment is more invasive and expensive, will become the norm. If there are millions of patients needing treatment, but only hundreds of dollars advocated to be spent on treating them, this is rationing. This also results in discrimination when Emmanuel's Plato-like plans are used to allocate money away from the oldest, youngest, sickest, or disabled to the groups he deems more important. I have a patient who found a surgeon to do her mastectomy for breast cancer, but can't find a surgeon to do the reconstruction she wants because the insurance allowable is now too low. A surgeon will not do a 4-hour surgery for $500 with all the associated risk and stay in business, or now out of the courtroom, or now even out of jail. Remember, Obamacare contains no real malpractice reform, just increased risk of audits and penalties for non-compliant doctors. Obamacare uses IRS agents, CMS auditors, even the likes of bounty hunters to control and intimidate doctors at a time when we could actually cure cancer and more, at a time when we can innovate and build on incredible science and technology. Medical devices and innovation are taxed, and anyone who does anything without government approval will be investigated. Already, physicians, including my friend orthopedic surgeon Dave Janda, an outspoken critic of Obamacare and radio host of Operation Freedom, and Dr. Ben Carson, who spoke out at the National Prayer Breakfast, have been targeted and aggressively audited, they and their families, by the IRS. The CMS and DOJ have joined in. One surgeon, my friend, cardiothoracic and vascular surgeon, Dr. John Natale, ended up as the first physician to be jailed for a dictation error in a signed op report. He was sentenced to 10 months in jail, served 9, 1 at home. These physicians must be defended and vindicated. At some point, it becomes risky, if not stupid, to practice medicine. Obamacare sanctions medical decisions made by unelected bureaucrats who doctor data and factor in cost at the expense of outcome. Kathleen Sebelius herself now practices politically expedient medicine, going against the established guidelines for mammograms that have given American women like me the earliest diagnosis and best survival in the world. The U.S. Preventive Services Task Force factored in cost and created new guidelines to save money but lose a few lives. Obamacare mandates must be followed. The outcry from women's groups and politicians was unprecedented, so Sebelius unilaterally added a single line to Obamacare in response to the political pressure to get Obamacare passed. Already there are signs that this will be reversed. A new class of medical articles is being generated and used. They include MBAs as lead authors, along with the MDs and PhDs. And we all remember little Sarah, who needed a lung transplant for cystic fibrosis. She was denied this based on outdated government rules. Only after massive media attention did Sebelius unilaterally acquiesce and grant Sarah the right to a lung transplant. We now have a system where a non-medical bureaucrat appointed by a politician can deem or deny medical care to individuals or groups of patients because it is politically expedient. And this is only the tip of the iceberg with what is so sinister and transformative about Obamacare. To make the numbers work, Obamacare took over the student loan business. This has resulted in higher interest rates, higher tuition, and thus increased debt for our nation's students. So how did Obamacare capitalize on this? Section 5210, read it, it's frightening. Obamacare creates a healthcare work corps. The newly indentured servant students can pay back their loans with 1 to 3 years of service in the healthcare work corps. They can be deployed to involuntary service, foreign or domestic, to any place deemed in need or crisis at the call of the Surgeon General. This has unspeakable potential, given the precedent and power of the President and Secretary to selectively reward, exempt, deny, penalize, or enforce their whim on individuals or groups for political expediency. It also gives unprecedented power to the Surgeon General. Now let's examine Obama's Surgeon General nominee, a young, inexperienced doctor I mentioned earlier, with no military or reserve experience who actually has that MBA. What qualifies him to hold such office with this newly granted power over America's students? Ready for this? He was co-founder of Doctors for Obama in 2008 and worked to get Obama elected. The organization's name has been changed to Doctors for America. Again, a political pal is being paid off. Obamacare gives the Secretary unlimited control over medical education now. She has billions to grant to medical schools, nursing schools, and other training programs that espouse her ideology. She's able to give money to influence curriculum, faculty, composition, and salary, and geographic and socioeconomic factors related to medical education and the number of type of doctors we produce. IRS agents that enforce the law and target donors. CMS that targets doctors and rations by restricting money, networks, and regulating. Unvetted navigators that could be felons. A massive data gathering website that's insecure. Bad ads, bad websites, wasting money, doctors going to jail, and politicians granting organ transplants. Who can honestly support this law? Lost lives, lost jobs, increased taxes, increased penalties and regulations, stifled innovation and research. We must stop this insanity. Spend the money on the patient instead of squandering it on statists. The biggest lie of all is that Obamacare opponents offer no solutions. We have solutions. They just don't want to hear them, because then they know that the American people would stand for the good solutions and Obamacare would suffer the fate of prohibition and be repealed forever. Groups like the Association of American Physicians and Surgeons, Docs4PatientCare, and our American Doctors for Truth have good plans. We must empower the individual patient. Each individual must be allowed to choose a health policy that best suits them and their family, and this policy must be tax exempt. This policy should be portable with the patient from state to state and job to job for a lifetime of continuous care. The preferred model is a high deductible, low premium, major medical model supplemented by health savings accounts, which are tax-free with high limits and few restrictions. Transparent costs are readily available to all across the board, from surgeon fees to operating room charges, from MRIs to labs and medications to medical devices. This model is patient-centered, free market-driven, physician-guided, with minimal government involvement. And then the safety net for the poor may be temporarily subsidized to let them choose from the same good plans as other Americans instead of sentencing them to Medicaid. Similarly, the elderly can continue on their plans into their senior years, using their Medicare dollars to continue with the plans they carried and loved throughout their lives. Doctors will be freed to provide charity care and will be allowed to deduct the associated expenses. The baseline health savings accounts can be funded tax-free by families, a better use of the death tax money. Charities, groups, or even government subsidies can help get babies out of poverty and get onto a plan they can carry with them throughout their lives. This will foster competition, transparency, individual choice, accountability, good personal health decisions, and preventive care while preserving privacy, dignity, and the sacred patient-doctor relationship of Hippocrates. We must recreate American medicine under the leadership of physicians the likes of Dr. Penn Carson, who value the Hippocratic Oath and human life, who exude compassion and courage. We must refuse Ezekiel Emanuel's remaking of American healthcare in the fashion of Plato and statists who mandate and compel humans to subjugate life to the collective good, who have little value for life, who exude disdain and contempt for the American doctor and patient, who lie and discriminate to achieve their needs. Contrary to what Ezekiel Emanuel says, they can't do this without us. We've got what they want, we've got what they need, and they can't have it. If we comply, we are complicit. If we implement, we are enablers. If we resist and stand strong, patients and doctors together to repeal Obamacare and demand good reform, we will change the course of history once again as true American patriots, in the footsteps of the original patriots, as the people our founders envisioned and the courageous people for whom they created the Constitution. We will secure our blessings of liberty for us and our posterity. If we do not, we are to blame for the demise of Hippocratic medicine and the death of the freest nation in human history. I will end now by reading a letter I received 2 days ago from Dr. John Natale, the first physician imprisoned by the government, sent to me to share with you here today. This is from Dr. Natale. Every young medical student and beginning resident is taught the time-honored principle primum non nocere. First, do not do any harm. I believe I have practiced during my surgical work of 32 years and applied it. I practiced that during my 32 years of surgical work and applied it also to my daily and family life. It is simply a corollary to the second greatest commandment that there is. Love thy neighbor as thyself. However, any semblance of fair play, human dignity, or any modicum of respect is totally devoid with any encounter with our Department of Justice. You are guilty as charged, and if their charges are not initially applicable, they will find or manufacture whatever is needed. You are dealing with pure evil and an insatiable intensity to completely destroy you and your family. Perhaps this is the unnatural feeling that it is difficult to comprehend for people like you and me that try to live a life of healing, caring, and being compassionate. Don't do any harm is not a slogan, but a way of life. There is no logical explanation for what happened to me with regards to my encounter with our Department of Justice. It borders on the Kafkaesque mentality with overtones of pure iniquity. But the scariest part of all of this is every one of you seated here today is vulnerable and prime targets of this tyrannical agency of the pharisaical title of Department of Justice. You cannot live your life as a cardiovascular and thoracic surgeon without being optimistic in your daily life. When my children would ask me what their dad did every day, I would reply, your father makes chicken salad out of chicken poop. I loved what I did, and because God's graces, I was damn good at it. It may sound incredulous, but I wouldn't trade places with anyone. That being said, I am not giving up on my country or my profession. There are too many good people in this country. However, there is a war on physicians in this country by the DOJ, and our medical delivery system is being dismantled in front of your eyes. Please, action is necessary. If I may be so bold, I would ask two favors from this august body of physicians and patients. First, please pray for Dr. Dave Janda and his family. We have to support this courageous human being and help him in any way we can. I and my family know what kinds of days are ahead of him and his loved ones. Secondly, if I could capture some of the incredible energy and spirit of this great state of Texas and receive national support from the medical community, I know we can get my case heard at the Supreme Court. Yes, my case sets a chilling precedent that any error in a signed medical dictation will be a felony in this country. I have lived that nightmare. I hope and pray that all of you will help us end that nightmare. Thank you and God bless. That was from Dr. John Natale, MD, and I thank you for your time today. This was important and everyone needs to know it.